I'm Dr. Vimal Raj. I'm a consultant cardiothoracic radiologist who specializes in imaging, CT, MRI and X-rays dedicated to cardiac and chest pathologies. This is our epicenter in the country, the Narayana Health City in South Bangalore, whereby we have one dedicated building only looking after cardiac cases for adults as well as pediatric cases. It's one of the beauties of this hospital that we are never short of patients. It's a sea flooded with lots of people there who come in from different parts of the country, from different parts of the world for that matter, and from different stratas of the societies. With technology, we are able to cater to more patients. We are able to provide the best in-class service to these people, and also we are able to confidently detect an anomaly or a problem, and we can confidently do the management. It's a 128 slice CT scanner. This hospital is a dedicated cardiac hospital. So we do significant number of coronary CTs and cardiac CTs. In coronary CTs, which is our prime focus, we are trying to detect coronary artery disease at a much earlier stage, and we are trying to detect these in younger people. So when we are trying to do that, you need to be able to reduce the radiation dose to a significantly lower amount so it does not harm the patient. And this machine, the Ingenuity CT from Philips, manages to do that excellently. So the radiation dose that we give compared to our older 64 slice machine is 1/5 to 1/4 in different patients. Secondly, in all these CT scans, what we are worried about is the image quality. With the Ingenuity CT, we are able to get excellent quality images, especially coronaries and cardiac, with very good detail examinations. So we are able to report it with much more ease than what we were able to do in past. The third point, which always comes when you're trying to do a coronary CT, is how do you manage high heart rates? Okay, if a patient has got really high heart rate, can the CT scanner cope with doing a coronary CT or not? And this machine has the capability of looking after the different variations of the heart rate and is able to cope with that. Another one specialty that we have, which we didn't have in our previous 64 slice scanner, is something called as prospective gating. The prospective gating again significantly further lowers down the radiation dose to young patients whose heart rate is well under control, and then you really are bringing it at par with some X-rays or CT of the chest that we are trying to do with regards to the dose which we get. Philips machine, what we've found is that it is a very user-friendly interface, and it's a simple interface where our technologist can easily understand, learn and also innovate within it. Philips provides us with IntelliSpace Portal, which is their standard workstation solution to be analyzing these images, and that works like a charm. It's something which we have been using for the last 1.5 to 2 years, and it is so easy. With a couple of button presses, we get the whole coronaries laid out in front of us, so we can analyze them and we can quantify the degree of stenosis with a lot of ease. So we've been blessed with the Ingenuity CT in the sense that it is ticking a lot of boxes for us. It's reduced the radiation dose significantly. My technician's job has become much easier. Interpretation and 3D reconstructions are also much more simpler than what we used to do. Image quality is absolutely great. With the IntelliSpace Portal, we are managing to get beautiful 3-dimensional images, and these images are also very easily acquired. We want to be able to do anything preventive, any scans, which is fast, which is easily accessible and does not disrupt anyone's lifestyle. So CT technology, what it allows us to do is that it's a simple injection, and we can within 5 minutes tell you whether you have got coronary artery disease or not. Your scan is normal, you can go back to work. It's like going to work at 9 o'clock in the morning, going out for a lunch break at 1 o'clock, come to the hospital, by 2 o'clock you're back at work with the relaxation that your heart has been looked after well. We wanted to buy a technology which is not going to get outdated in the next 2 years. We wanted a technology which reduces the radiation dose that gets exposed to the patient. That's very, very important for us. One of the major deciders for us is that the post-processing software capabilities, which make our reporting much easier, is it good or not? And IntelliSpace, we found, was a front runner by far compared to the other vendors. It was able to do all that we wanted without we having to get up from our seats and go into a different room. When we talk about the machine itself, when we looked at the parameters of radiation reduction, this did a great job for us. Any brand is only as good as what after-sales service you give. Okay, now selling a machine is very easy, and if you're not able to give us the support for these machines, then it does not make any sense. And Philips manages to do that very, very well. We have different machines, we have different vendors. So we have experienced every vendor, we have experienced every vendor's after-sales support. And Philips has been by far the best in providing us that, both pre-sales as well as after-sales support. They know that the number of cases that we do in these scanners are huge. We are at an average doing 22 scans per day in this machine. Now when we look at that, it is purely cardiac. And that, you can understand, is a high intensity work. Cardiac takes a lot on the machine and on the X-ray generator, and it's been working excellent for us. So we are quite happy that we took the right decision. Philips as a brand is something over the 4 years I have seen with the technology that Philips has come up, primarily cardiac technologies, both CT and MRI. I think they probably are the best in the field of medical imaging on today's date.
Innovation and you. Philips.